Hi everyone, my name is Francisco Llano and this is Connected, the podcast of Nova Economics Club. This podcast is done in a partnership with Fidelidade Studio. We would like to thank Fidelidade for giving us access to the studio and its equipment. Today our guest is Professor Pedro Pita Barros, who is joining us from home. Professor Pedro Pita Barros is a professor at Nova SBE and also a researcher. He is largely recognized to be one of the greatest economists in health economics, and he is former president of both the European and the Portuguese Health Economics Associations. Professor, thank you for coming and for joining us here.
Thank you for the invitation.
To discuss today the impacts of COVID-19 pandemic in the health systems and how health economics can have a positive impact in preventing situations like we had this time with COVID-19. So first, Professor, a more general question. COVID-19 has challenged healthcare in ways that were basically never seen before since we had the last pandemic in the previous century, but the health systems there were completely different than today. Our health systems today were faced with this pandemic when no one could have saw it coming. So what do you think are the major lessons we should take from this pandemic to our health systems? How can they improve? How can we be prepared for something like this?
We are still learning the lessons, so this is much of learning on the going. But we can already take some lessons from what happened in the last 8-9 months. The first of them is that no health system is really prepared for a shock of this magnitude. And so what probably the best that health systems can achieve is to try to be ready, to be prepared when the occasion comes. What means is that they need to have in place what we call now resilience systems, or what we call preparedness, whatever you want to call it. But it's not just having capacity or having human resources. It's just having the flexibility to learn quickly how to deploy the resources that we have in the most effective way. So it's virtually impossible to be prepared for any shock that may occur in an economy in terms of health, or in a society in terms of health. So we cannot be prepared for everything that may occur. We need to be prepared to be prepared. So we need to prepare the preparation. So when we have a shock, we are able to react and then adjust what is needed for that shock. That's probably the major lesson at this stage. But we also have a series of smaller lessons from the very small details to the very large picture. And we can put I'd say in different layers of lessons. The first one at organizational level. We have learned from the beginning of this pandemic the importance of having the ability to react quickly, to give freedom to decide, in this case to hospitals, in terms of preparation for the pandemic patients, and the way they have taken the leadership in their decision making without waiting for very bureaucratic decisions to be made at the central level. We saw the hospitals starting to change and starting to increase their own flexibility to react to the pandemic demands. And that's probably the first lesson. Decentralization and the freedom of decision making at lower levels at the hospitals actually pays off in terms of flexibility to respond to the pandemic. And we have seen that in Portugal when we had the first hospitals to be hit by the COVID-19 patients in the north of the country, start putting in place lots of mechanisms, or several mechanisms, to deal with it, with the flexibilization of internal services, new routines, separation of circuits for patients with COVID and without COVID-19. And all of that experiences in the first days, the first weeks, were then passed on to the rest of the health system, in particular to the hospitals in the National Health Service. So that's the first lesson. We need to react quickly, learn fast, and pass on those learnings. Then we have a second layer of learning, a second lesson that we got from the pandemic was the sheer importance of having a good primary care network. Although much of our focus currently goes for the hospitals and they are more on the spotlight, it's the case that the vast majority of patients are actually followed by primary care services, by primary care physicians, by the family doctors. And because we have close to 90% of patients actually being treated at home, told to be in confinement, to take just paracetamol or some drugs to lower the fever, and only if they need, they should go to the hospitals. And that was an important lesson in the beginning of the pandemic. We all had in mind the TV images from hospitals in Italy and Spain that were overridden by patients at the time, and we avoid that in the first wave just by having a strong primary care system that actually was able to take care of the patients. This is also true now. With the number of people infected that we have nowadays in Portugal, more than 100,000 people, it will be impossible to have all of them in the hospitals. So we need a strong primary care network to take people, to treat people at home, to take care of people if they stay sick, but they stay under vigilance in their own places. And so that's probably the second lesson that's important. It's not just the hospitals that matter, it's the full cycle of care from primary care to the hospitals. The third lesson that we got is that public health activities, in particular the public health ability to trace contacts, to understand how the epidemics evolve, which was slowly fading away into oblivion. So nobody was paying too much attention to it, now regained focus, and we have learned that we cannot neglect public health, we cannot neglect primary care, we cannot neglect hospital care. So the health system as a whole needs to be coherent, needs to be totally integrated in terms of the ability to respond to these pandemics. And if we look now at the current situation in our third wave, let's call it third wave, the current momentum, it's clear that if we had a still stronger public health system, probably we'll be facing this period with less difficulties than we are having. And so that's the third lesson. We need to take all the public health elements into account. Even in the normal times, they seem to be of less importance. Cannot be that only in crisis we will have to pay attention to them. So that will be this kind of a third lesson. And this covers pretty much the lessons on the health system organization. Then we have lessons for society as a whole. First of all, we have lessons for official communication, which has had high moments, very good moments of good communication with the population and getting things done, and they have low points as well. We had ups and downs in this communication, and it's not easy to sustain effective communication for a long time. In this case, we are going for close to 10 months of the pandemic, and it's important to learn what has worked and what has not worked, how people have been paying attention to what, how people have been following official communications, and how they're respecting recommendations. That's the fourth lesson. It's much harder to establish effective communication during a pandemic than just for short bursts of need. And long-term communication to be effective, credible, needs to be thought very carefully. If you want, later on we can distinguish eventually some periods on this communication, but it's clear that it plays a major role during the pandemic period. The fifth lesson, I might keep broadening up the type of lessons, is the importance of science. Today we have some hopes that the pandemic may be over soon, maybe by the summer, maybe slightly before, slightly after the summer, based on the vaccine. Now, vaccines were developed in this case with safety in record time because science was able to gear all the efforts to the production of the discovery process of a vaccine. True that some of the knowledge was on the making for several years. We knew more or less several processes by which we could try to get a vaccine, but science and scientists were able to produce in record time something that gives hope that we may put the pandemic behind us in less than a year from now. And that's another important lesson. Science pays off, and does not need to be necessarily science for the market in the immediate future. Sometimes long-term science pays off in unexpected ways, and here in the development of vaccine, probably that's the case as well. Some basic science was put to use this time when it was time of need. Another lesson that we are learning every day is how interconnected the health of people and the economic system are interconnected, how they are interweaved, let's say, in profound ways. And we discovered in the hard way that there is not really a choice between health and wealth. We have both of them going together, and it is quite curious that we saw in Portugal during the first days of the pandemic, March last year, that the major concern of people was with health. But a month later, 2 months later, there was already at the same level or even higher for some groups, worries, concerns about economic impact that people were feeling from the pandemic. And clearly health and wealth go together on these matters, and is going to put some challenges that will not end when the pandemic ends. So the economic effects of the pandemic will remain for several more years, maybe 5 years, maybe 10 years. It's too early to know, but it's going to be also lessons for us economists to think about how to prepare better economic systems or support systems from the government point of view to the economic shocks that may accompany these sort of health shocks as well. That's also a lesson on the making at this point. And we'll have learned other aspects on a general level. We'll learn as society things like the importance of individual freedoms and the importance of mental health. And it's clear that many of us now probably are giving more value to the freedoms and to ways of life that we had before the pandemic that we took as granted, and that we saw that could be dramatically changed in a period of crisis as this COVID-19 pandemic was. And that probably will make us later on rethink about how we organize our lives and how we organize our work. We have learned also that working from the distance, like we are doing at this very moment with this call, will change profoundly several ways that we have developing work. But it also has some dangers. It is after 8 months, 9 months of this telework, we are now becoming aware that some elements of personal interaction or physical interaction in the same place are as important as the knowledge or the discussions that take place, and that physical presence also plays a role and cannot be fully substituted by electronic communication means. And that's also an important lesson. Probably in the future, we're going to see less meetings taken by physical presence, but not all of them will disappear, and probably it's not good that they would have to disappear. The same thing for schools and learning. We have, although the schools in March last year were the first activities to close down, out of fear and out of lack of knowledge of how the pandemic would work. Nowadays, we are keeping schools open, and it was actually highlighted by the Prime Minister as one of the major changes to the previous general confinement. And that was a lesson learned, that schools are an important element in terms of learning and cannot be replaced by the electronic means or distance learning. That's also a lesson that we got from this period. On terms of the job market and what working in companies, we also learned that there are some activities that can be done at distance, so you can use telework, but there is a danger that the boundary between work and family, between work and leisure, start to fade away. And while we have a clear cutting point when people have to commute from work to home and have a break point in their activities on that, if we are doing all of these things at the same time, then the frontier becomes more blurred, and sometimes you may getting into too much work and entering burnout, just because it's very easy to keep on the demands on people to keep working after hours. That's going to be a lesson as well, that we can benefit from these new communication means, but we cannot take them too far, as taking them too far will probably be hurting the balance between life and work, family life and work, and so on. So that's also something that we are still learning how to deal with it, but it's certainly a lesson that it goes. And basically we learn that as human beings we are highly adaptable, some better than others, but we have been able to kind of reshuffle our lives in ways that probably will not think that will be possible if we talked about this a year ago. And we still keep the hope that things will improve, and we still keep trying to have lives as normal as possible, adjusting in the possible ways. And so we have basically lessons. When you ask about lessons from the pandemic, we have lessons from the organization of health services to lessons of how we live in society. So you can pick which one you want to take first for further thoughts, but certainly all of them deserve some discussion, not really now today, but into the future, and in the way that we look back into the pandemic period.
Okay, thank you, Professor. Going into an idea of technology and investment, especially in Europe, that was probably, except for the United States, we saw that Europe was generally as a continent very affected by the pandemic. We saw that in Europe, the countries' populations are being elderly, and we saw that health systems are not receiving as investment as they should have been receiving. And we saw that they were still dealing with new problems and new situations using the tools of the past. Do you think that if new technologies have been taken into account and if more investment was done before, the way that we face this pandemic could have been different? And also, if you think that in the future we are going to learn those lessons you said and actually do it differently and try to solve our new problems with new solutions?
Well, certainly we're going to use technology in a different way. This pandemic brought a challenge that some of people anticipated that could be there for the future related to the elderly care and long-term care. But actually, I think nobody has foreseen how strong people in home cares, in nursing homes, will be affected by the pandemic. And we saw that in many countries around the world, not just Portugal, that elderly people living in special places, nursing homes, or what we call in Portuguese home structures for the elderly, in a loose translation of estruturas residenciais para idosos, we saw that they were particularly affected. And that was true in so many countries that actually no system was actually prepared for it. Now, that part of home care, of nursing homes, is not just related to the health sector. Actually goes to social solidarity, social security systems, to a broader view of how our societies support life at the end of life. How do we take care of the elderly? And the speed at which the virus has spread on those places and the inability to contain the contagion in an effective way was something that we still have to learn to do effectively. It's one thing that we have learned from there is that it is important, but we haven't discovered yet what is the right mechanisms that we need to have in place to avoid contagion and to keep those people safe. And that's something that we are still getting. And it's and the technology alone is not getting to it. We cannot do much more with the new technologies when we have people that need to be taken care in terms of individual hygiene, or they need to have someone with them because of mental health conditions. And so the human contact, the human presence of people with those elderly is something that technology is not going to change. We're going to be getting technologies to better monitor what's happening to them, to have early signs of people falling, for example, or having better devices to trace and track the virus and find people that are contagious. We can certainly improve on those mechanisms, on the circuits of people that enter those places, but there will always be a human element that will not be able to cut off. And so the challenge here is not just a challenge of technology, it's also a challenge of organization and a challenge of how as societies we want to deal with the elderly. Now it's going to be needed probably more investment, but mostly different investment. One of the most pressing challenges that the elderly population poses is not a challenge of money, it's a challenge of organization. And by this I mean the following. In the elderly population, we find huge variation in conditions, and people that need to have someone by their side almost all the time, and people with the same age that are completely autonomous. And if it were not for the pandemic, they will be traveling around the world, seeing the world. And so we have a huge variation, and health systems and social systems in general are not well prepared to deal with this diversity of needs, of still life goals that people may have at the end of life. And so the health systems need to evolve in their organization, in their way of thinking, and on how to deal with this diversity. How can we incorporate the possibility that people with exactly the same conditions may actually have very different paths in life for the life that remains for them. And that's and dealing with diversity is the difficult part, because it implies that you cannot just have a standard, you cannot just have a guideline that fits everyone's needs. You need to have a more flexible system. A quick example that you often use. In the elderly, one of the risks that they face is that they may fall and they may break a leg, or they may have some injury from falling. And so if you want to protect them, you should keep the elderly people the whole day seated, because that will be the way to avoid a fall. But actually, seriously, nobody thinks that everyone above a certain age should be seated all day just to avoid a fall. So there are going to be risks that people will be willing to take some normal life. And on that part, it's quite curious that one of the aspects that extends life of people is not protecting them from risks, it's keeping a sense of purpose in life. And so this means that defining and helping people to pursue still a sense of and a purpose of life at the end of their days is a challenge that health systems are not used to. And a system that requires diversity. And that's why I don't see that technology alone will be able to solve that. Technology will be an instrument to help people find those goals, and eventually to help the health system deal with this diversity. But they will be a tool. They will not be the silver bullet that will solve everything. So we're going to need more investment, sure, but we also need to have a different approach to how we deal with this aging population during this pandemic and in the future pandemics. And we see that one of the major complaints of the elderly is that they don't want to be stuck at home until the pandemic passes. Since the beginning, there was a strong desire from many of the people that were at higher risk to not lose total contact with others. And so that's something that we have to deal with in the future. And again, technology will not going to solve it. It's not going to be a robo-pet that is going to solve the ability to talk with other human beings or to get out for a walk or these sort of things. So technology helps. It's not going to be the only answer to this.
Okay. Regarding the divergences between countries, we have seen that we knew before the pandemic that different countries use different health systems. We have tremendous variety of them, even between countries that are really similar when compared to other economic indicators. For example, between different countries inside the EU, we have tremendous differences when it comes to health systems and the way they approach the health of their citizens. Do you think this pandemic has shown us that the flaws of each system and how can we improve each system, not like one being better than the other, but that this pandemic has shown us that no system is perfect and how each system should be better and should be different for us to have different results than the ones we got here?
Yes and no. Let's say the differences between health systems exist for a long time, and we have learned to live with them in the European Union. We know that each country has its own history of health systems, and curiously, nobody is totally satisfied with the health system that it has in its own country, but actually nobody is really willing to trade off its own system for a system of another country. And so it's a kind of difficult path to navigate to understand exactly how they will have to change. But at this stage, on the pandemic, after all these months, I think that the most important part is not exactly what is the definition of the health system that is mattering is how within the health system decisions are taken and how political decisions are taken related to health matters. And we saw during all these months that in the first wave we had countries that reacted very quickly, that closed down very quickly and tried and contained very effectively the spread of the virus. And the very same countries, several months later on, they were not just able to contain it, and they were just among the worst in Europe in terms of speed of the spread of the virus. And so it's much more with the ability of decision makers, political decision makers, health decision makers, to keep a steady course and understanding what is the information they have and how far they can go in terms of navigating this pandemic. This pandemic is probably more challenging than it seems for health systems when we look at it from the outside. For the simple reason, we might tend to think that the health systems will be a kind of clockwork machine, that you have decision makers that they see the problem and they put the system to work and they solve it. The problem here with the pandemic is that part of containing the pandemic lies with behavior of people. It depends a lot on how we behave in terms of decreasing the contagion that exists, on keeping the physical distancing, on taking the necessary precautions. And so it's not a problem that the health system can fix easily. No health system can say, let's get everyone infected and the health system will be able to treat everyone that needs. There's clearly the notion that no matter how well developed the health system is in whatever country, now doesn't matter how good doctors, how many resources they have from nurses and so on, that if with such an infectious disease, if everyone gets sick at the same time, we will not be able in the health systems to take care of everyone at the same time. And that puts a burden, and that puts the need that you have the population contributing a lot to avoid being infected. And that's the challenge that the health systems have to navigate for the time being, and that's what they had to navigate in the last 10 months. And that's the critical part, and that's where we go back to the issues of communication and having a steady course. And we see that the differences between countries are important, but somehow the differences that we observe inside each country between decisions in one moment and decisions in another moment that try to answer the needs of society and the aspirations of people of being confined to stop the disease, or being out of confinement to resume some sort of normal life because of economic reasons or for mental health reasons. We see that there is a delicate balance that changes over time, and that is different from country to country. And up to this point, I don't think that any country has found the exact right balance to do it. And we saw that countries that are very successful during certain periods then seem to be failing later on, and they seem to become successful again, and they come and go on this I could call it, someone has called it, of this dance with the virus, where we confine, deconfine, reconfine again. And this is the hard part for the health systems and for the decision makers, is to understand how to better play with the ability of the health system to treat the serious cases of infection and the behavior of people in avoiding infection and at the same time having some normal life. And so that's why it's been so difficult and so with such a huge variance across countries and across months, sometimes even across some weeks.
Okay, Professor, just to conclude, keeping ourselves in this governmental idea, nowadays we saw that health authorities, even inside a government, took, as we could expect, a major role. We saw as many interventions, for example, in Portugal from the Ministry of Health or the General Health Director, even more interventions than the Prime Minister himself. So do you think that in future we say, like, we leave the pandemic and several years later the health authorities will remain having a major role as they are having right now, an important role, and they will not be forgotten? Or do you think that our memory will be short and governments will relegate the health authorities to a second position as they were having until now?
Well, political memory tends to be short, and so probably some of these aspects of the widespread attention that politicians or political powers give to health will tend to fade away a bit when the pandemic is over, because then other pressure points or topics will emerge, and probably recovery from the pandemic will be a topic after the health part is kind of over. Probably the same thing with the fears of financial crisis, either at personal finances or on firms' bankruptcies. So I'm sure that in 2 years' time, other topics will be more preeminent than the health part. The hope here is that we are able to take this period and start to put inside the political system, inside the government system, so get even into the health system, get inbuilt mechanisms that when a new shock arises, and we don't know where that shock will come from, when a new shock arises, we know better how to prepare our immediate response. And so that's where we see now and kind of discussions or kind of preparations of thinking about what means to have a resilient health system. What will be the features that the resilience health system should have? And resilience here means the ability to feel the shock, to absorb the shock, to react to the shock, and to learn from the shock, so that in the future the system will be better prepared. And so there starts to be thinking about how we should change our institutions and our frameworks, so that we can have mechanisms that in the future will react better to the shocks. It's quite interesting to notice that as the same way that we created stress tests for the banking system because of the banking crisis, we are not talking about creating resilience tests for health systems to understand how they can react better into the future. There was a recent document by a group that is working with the European Commission called the Expert Panel on Effective Ways of Investing in Health, which just released a document on how to try to have resilience tests on health systems. There is also recent work by the European Observatory on Health Systems and Policies and the World Health Organization Europe, WHO Europe, on resilience of health systems. And so you're starting to see emerging a discussion, first in these background discussion elements about what could be done to make the system, the health sector, more resilient, what will be the features that should be built, what mechanisms will be there. And the hope that I have is that in the future, even if the health shock on the health management under shocks becomes a little bit out of the focus of the moment, which is natural to happen, that at least we are able to include in the working of our governments, of our health systems, of our societies, elements that in the future will help to react to other shocks. And here the truly difficult part is that we don't know what will be the next shock. And so the logic that we need to be prepared to learn fast and to react fast is probably one of the things that we have to prepare for the future, and that policymakers will be prepared for that. And the involvement of the political actors in Portugal in that part is also quite important, because the way that the Prime Minister has been handling with the President of the Republic in tandem with the Prime Minister is probably quite unique in terms of opportunity. It's difficult to go back to our history over the past 40 years and think of a period where you could get so easily this sort of cooperation that has been happening. And that could be also a lesson for political actors, how political actors should interact with each other, not only in moments of crisis like this one where we need to have this joint effort, but also in other times to solve other problems. And so I think that's something that we can learn for the health system, but probably something that can be learned by the political sector and so on. So there is topics for discussion for political scientists as well on how to deal with this pandemic.
Okay, Professor, thank you for us. It's all. This was the 4th episode of Connected. We hope you've liked it. And Professor, once again, thank you very much for joining us today. Thank you.
Thank you for your interest, and I'll be glad to answer questions by email or read comments that the listeners may have. We can continue this discussion in other means at some point. Thank you.